On behalf of ExpertVillage here at Jean Prairie, I'm Gloria Van Workum, and I need to talk to you about chemotherapy patients and purchasing their wigs, telling you what you should do. You should probably have 2 wigs to get you through your treatment, because it usually takes about a year. If you get 2 wigs, you can interchange them, and you can have one while you're washing the other one and interchange. And if you decide that you'd like 2 different styles, you could go with 2 different styles, and you could get one that's a little less expensive, one that's a little more expensive. Most of the wigs that we carry here are very reasonable. We don't try and get a real expensive wig. We have some that are quite expensive that are monofilament based, which means that you can see through to the scalp. If you need to make a part in your hair, if you're used to wearing a part that you really like and you want to keep that part, monofilament is excellent for that. You don't really have to have that, because sometimes we can make a part to camouflage. So the different prices of wigs are